Once I was diagnosed, we knew it was cervical cancer, but we didn't know how far progressed it was, what treatment was going to be required. I was sent for a series of tests, blood tests galore, which I just hate. You feel like a pincushion by the time you've left, a chest x-ray and an MRI scan, which was horrible. I hated it. You're asked to lie incredibly still for a good half an hour, which is a hard thing because when you're trying to lie still, suddenly everywhere itches and suddenly you can't keep yourself still, and even breathing, so am I breathing too heavily? And it's a very loud machine and it's a very tight space that you're sent into. So it is claustrophobic. Even for someone, I wouldn't say I am claustrophobic, it is. The noises it's making. Plus you're there knowing what you're there to do. It's not like, okay, this is a horrible machine, it's loud, but it's to make me look pretty. It's to look for cancer. So you're thinking of that and you're going through it all. They play you music to try and distract from the horrible noise. They give you headphones. It's probably the worst music ever. It's not your personal choice. It's sort of just not something I would ever have listened to. So that doesn't actually help. It's more sort of frustrating that you're then listening to that because you just think, oh, what am I listening to? And it's just not a pleasant experience.
I had an MRI scan which gave him an indication of the size of the tumour and whereabouts it was situated. I was then also given an examination under anaesthetic, EUA, the terminology often bandied around, which allowed the consultant under anaesthetic to get a better and clearer picture of what was going on. Again, without having to cut, it went again through the vagina using a camera and had a really good look, because an MRI scan will show where the tumour is and the size of the tumour, but won't necessarily show anything around there.
I spent a lot of time in and out of hospitals for various appointments, and there's a lot of, here's your MRI scan, your results will be sent to your doctor. So you've had this, and obviously everyone would ring and go, oh, how did the MRI scan go today? It's like, fine, I don't know anything. So you have tests after tests. It was every Wednesday. I was in on for some reason my appointments were Wednesdays. So for 4 weeks, I was in hospital every day on a Wednesday for hours for various tests with no results, with not knowing really what this was sort of leading to. Upon the results from that, I received my next set of bad news. It was a large tumour. It was 4 centimetres. So it was too far progressed for some of the smaller surgical procedures that we'd initially hoped for. We needed to do some more tests, some further research into how far progressed it was. So I was sent for keyhole surgery, which I had about a month after diagnosis. They finally were able to deliver some good news. I was told that it hadn't spread. It wasn't in the lymph. Good news, you're having a hysterectomy. Double-edged sword in a big way. Yes, it was great news it hadn't spread. It was a really brilliant thing that I wasn't going to require chemo or radiotherapy. However, I was facing a hysterectomy at 25.